Hello, I'm Steve with Fitness for Five, also the CEO of Fitness for 10. I'm here with Dr. Nario of Biointegrative Health Clinic, and we've got another interview for you. This time we want to talk about ozone, which is a treatment that I get quite often there at the clinic. So what is ozone?
Hi, Steve. Hi, everybody. Well, this is a topic that's of big interest to everyone out there. It's just one of the bigger mysteries what ozone is. But let me start with the molecule ozone. It's actually three oxygen molecules, three O molecules stuck together, and it's water soluble. It's inorganic, and it's best to remember as the ozone layer. So the ozone layer, as we always know, has the highest concentration of ozone in the stratosphere. And this is actually the one that protects us from the UV rays, because when the sun hits the ozone molecule, it splits up. And it actually diverts that UV ray. Instead of going to us, it's actually getting us shielded from the harmful effects of the UV rays. But now, I want everybody to be reminded, COVID is around, and there are air humidifiers out there that produces ozone. And it's known to kill viruses, disinfects the air, the microbes that are out there. It's just a testimony of the antimicrobial effects of ozone. In our topic, we will be talking about none of those. We're going to be talking about the medical application of ozone. And according to the American Academy of Ozone Therapy here in the US, it's defined as the reactive, pure form of oxygen to create a curative response to our body.
Okay, so how does that work?
That's the bigger mystery of ozone. So let me explain that to you. Ozone is unstable. And what happens here is in our cells, we have fat layers, the covering of our cells. As ozone connects with the fat layer, it actually produces stress to our normal cells. And the interaction increases the production of antioxidants, increases blood perfusion, oxygen delivery to the cells, and even enhances the immune system. It's almost like how I can compare this is you threw a pebble in a pond, and as you see that pebble does a ripple effect, it actually is comparable to the effect of ozone to our body. And the thing here is the O3, so the three oxygen molecules, when in contact with that fat layer of the cell, it turns into hydrogen peroxide, which is an IV that we always also give. And the hydrogen peroxide gets neutralized by the normal cells through the enzyme called catalase to I guess, transform it into a safer molecule, which is water and oxygen. That's why when I mentioned hydrogen peroxide a while ago, this is almost similar to getting high doses vitamin C and also hydrogen peroxide, because it's called pro-oxidative therapy, increasing the oxygen in our body.
So what's the difference? I mean, you could get a peroxide treatment, you could get an ozone treatment. Is there certain times when you would say, I want you to get an ozone treatment as opposed to a peroxide treatment or a mega C treatment?
Yeah, yes, there is. The thing there is with mega C, so high doses of vitamin C, they turn into actual peroxides. The thing there is you're missing the vitamin. When people has vitamin deficiency, for example, let me give you a good example, cancer. Cancer is not only related to cancer cells that are growing, but also vitamin deficiencies as well. That's why we prefer high dose vitamin C for our cancer patients, because of these ongoing nutritional deficiencies. For peroxide, if you give it pure peroxide, you actually can have the effect of an immediate burst of peroxide killing immediate infection. So that's why when somebody's sick with a viral infection or some a bacterial infection, and when they have fever or actual acute visual illness, then hydrogen peroxide is best. For ozone, so ozone is almost similar to those agents, but the difference with ozone is you can actually do other things with it. You can inject, you can actually rectal insufflation, you can actually even, there is a treatment that we use on diabetics with gangrene and just isolate the gas in that specific foot or leg that's about to be taken off. And ozone regenerates that. You cannot do that with high doses of vitamin C and peroxide. That's why it really depends on the case and where you're going to apply it.
Okay, so I can see that it's important to have a doctor that knows what he's doing with this stuff, because you've got 3 different options that are similar. That makes sense. You can kind of isolate the ozone, but you can also do it intravenously. So is there some type of medical ozone, or can you just get it over the counter, or tell me about that?
Right. So when I mentioned about medical ozone, this is you're using a machine to generate the ozone, and you're going to use that machine to give medical interventions. The thing here, there are medical ozone machines that are out there, but they are less potent, meaning it's just more for, well, majority of them are to clean the air that you have. But the one that we use here is it's a mechanism involving oxygen. So we have oxygen tanks passing it through a machine, and the machine is like a slicer. You got a little knife, you slice it up the ozone. So oxygen molecules are 2 molecules, and you slice it up into 1, so O1s. And as we pass more oxygen in there, now these O1s that I got sliced up are going to attach to another oxygen molecule, which is O2, making O3. So that's how you generate these ozones through a medical machine. And there are different delivery mediums that you can use it on. So let me give you an example. The most common one out there is the major autohemotherapy, wherein they get blood from the patient and they ozonate the blood and they put the blood back into the patient. So when the thing here is you put more oxygen load in there and also the ozone in that blood so that it can recirculate in the patient's system. And the big difference that you would notice with this ozonated blood, it's pinker. It has way more color than your original blood, meaning more oxygen.
Very interesting. So I'm learning that, because I've done ozone there at the clinic, but mine was an IV.
Yes.
So what are the different ways that you can administer ozone, and why would you use one over a different type of administration for that same ozone? And what are some of the differences? Why would you use one or the other depending on the person?
So let me go back to that. That's a pretty good question, Steve. The first example that I gave was the blood, wherein you put ozone in there. So you use that in cases such as infection, viral or bacterial, or even autoimmune problems such as lupus, RA, cancer, to support these conditions. And as you would notice, what is the commonalities of these conditions? They're systemic, meaning it needs to go inside your body to cover all the areas that you would need. The other administration now, as you would notice, would now differ in locality, such as direct injection. We inject ozone into a muscle, into a disc, or into a joint, meaning if somebody has knee pain, osteoarthritis, muscle pain, or back problems, we focus on that specific area. So it's an isolated area. You don't need a big coverage. Another one is rectal insufflation. This is where you get an injection, a syringe with ozone in it, and you put it in the rectum. The thing there is, for patients who cannot have the convenience of getting an IV, this is one of the better options, because there are so many blood vessels in that rectum that when you push in ozone in there, absorption happens so fast that it becomes systemic. But again, there's only limited amount that you can give through rectal insufflation, and IV is still covering more ground. Another one would be insufflation of your nasal passages and even the ear or even the vaginal area. Because when you have infections there, these are more focused on infections like nasal infections, ear infections, and even vaginal infections. You can actually inject ozone air there and it gets absorbed fast to kill these microbes. And also limb bagging. So I just mentioned to you about the gangrenous foot of a diabetic. If you want to save that, you wrap it in a bag, a sealed bag, and you blast ozone gas inside so that it can actually have that local effect of regeneration, killing possible infections in that specific wound and help it to recover faster. So those are the most common ones out there and how you administer ozone.
Okay, so my last thought or question on this is that's a lot of ways to do it. I mean, it takes, knowledge to know what to do for each person. So is this all safe?
Well, that's the biggest concern of everybody. What? You're putting gas inside my body? I mean, it does it's a pretty legitimate question and fear. But the thing here, it's a gas. It dissipates. It spreads so fast, and most of the time, it's pretty safe in the hands of professionals. So that's the thing. I wouldn't suggest you buying a home ozone machine and doing all these procedures on you. But the thing here is the scary part is mostly when you inject ozone, you're worried about air embolism. It really doesn't happen that way. It's just getting absorbed so fast that it becomes more helpful than harmful. And the special method that you do here in the clinic is something that we avoid getting blood drawn out of you for the reason that, as you know, exposure to blood exposes the patient and the health provider to more infections. And you don't want that mess of dealing with blood. That's why we use a special solution to let ozone stay in there and be infused in a patient. And also, the thing there is it's almost similar to, it has all the same effects of like injections, wound care, insufflation, but even better because it's systemic. The key here is the experience of your provider and how safe they can administer it. For here, we've been doing it for almost 30 years.
Wow. Okay. Another great treatment. Dr. Nario, he's at the Biointegrative Health Clinic. Thank you again. Thank you for the information, and we will see you next time.
All right. Thanks, Steve.